Hey, it's Dr. Marku. So I want to talk about large FUE sessions. On social media often, and even in consultation, I see patients who claim to have had 3,500 grafts at one time in the past. And when I see these patients, I notice that they don't have appropriate growth. When I see it on social media, sometimes I see before and afters that seem too good to be real. I can't comment on whether they are or not. But all I could comment about is why I don't offer these large sessions. And the reason is really simple. The more hair you try to pack in at one time, the less chance that you'll have full survival. We want to have close to 100% survival of our transplants, and we like to think we get that. And if we're doing it right, we very likely do get 100% survival. I often tell patients 90% because who knows, maybe a scratch in the middle of the night, or I always leave a little room for error. However, if you try to do over 1,500 to 2,000 true follicular units, and I mean true follicular units means we don't divide them up after we harvest them. We don't cut a 4-hair graft into two hair grafts, or we don't chop up a 3 into a 2 and a 1. Just to tell a patient larger numbers of grafts. I don't do that. So basically, I don't like doing these large sessions because I see too much growth failure, and sometimes I even see damage from what we call necrosis, which means that sometimes the previous clinic packed too much hairs at one time, and they overtaxed the blood supply. Blood supply wasn't able to handle it, and the skin sometimes dies and requires wound healing. So, and sometimes leads to, of course, scarring due to that. So we stay away from that. You're better off to do 2 sessions, to do a frontal area and then go behind it 6 months later, rather than trying to do the whole session in one time. Well, number one reason for that is we may be harvesting from areas that are not safe, meaning areas that are thinning and are not meant to regrow or are not meant to grow for a long period of time. So you're wasting your time, you're wasting your hairs, and probably spending a lot of extra money. You're better off to make sure that the physician stays with a safe area, does an appropriate amount at one time to assure you're going to get proper growth, and then come back and do a second session to assure you get proper growth as well. You're going to end up with more hair in the end. You're going to end up with a better experience, a more comfortable experience, and you're not going to end up with complications. And you'll probably end up spending the same amount of money. So that's my message as far as these sessions that you read about that are 2,500, 3,500. Be careful. Also, be careful of the experience of the physician, as always. That's always my last message. Check their experience. Make sure it's not a new guy that they just came out last month or last year, or has been fiddling around with it for 2 to 5 years, doing maybe a couple surgeries a month. And make sure they have a stable staff, because that's part of the team. And always be careful of clinics or physicians that utilize staff that bounce around from clinic to clinic. I never thought that was a good idea. So sometimes they're performing illegal tasks, so be careful about that. But otherwise, that's my message. Have a great day.